Hi everybody, my name is Jesus. First of all, congratulations on being here. It's been quite a progress, and everybody who's made it here understands the stress we've gone through to get here. But congratulations first of all. So my name is Jesus. I am currently an emergency room nurse. I have been finishing my orientation there since April. It's an 18-week orientation with time off orientation the next 2 weeks, but that's where I've been here in San Antonio. I'm working at University Hospital. I'm also a 68 Charlie in the Army, which is an LVN, so I do have some LVN background in my life. I just recently came back from a deployment in April. I was part of a forward surgical team, so exposed to a lot of firsthand traumas and whatnot. But as far as my field, I've worked LVN experience, and I did some nursing home. I did some skilled nursing rehab facilities, and then now I would say my RN has now started off in the emergency room. So that's kind of where I've been as far as me. Community nursing, I don't have too much community nursing, I would say. The nursing home, I guess, is kind of serving the community. A lot of the patients that I work with have been around the city of San Antonio for long periods of times, and their families are also part of the community. So they always come to us, but haven't really done a whole lot of community outreach. Working in the ER, I do feel like you help out the community a lot because a lot of the people that we cater to are from the local community. They don't have insurance, they don't have homes. A lot of them are homeless. So definitely a big part of the community. But one thing I do look forward to taking out of this course is how to reach out further to the community. So essentially, me being an emergency room nurse, how I can take my knowledge, my skills, and my expertise and help the community. I feel like our community, especially being here in San Antonio, predominantly Hispanic, Latino, Mexican American population, a lot of it has to do with education. So a lot of the patients we see in the emergency room are not properly educated. They lack a lot of education, and I feel like as a nurse, that's something that we can reach out into the community to help. So I definitely have seen that my hospital, University Hospital, has a lot of pop-up clinics and mobile tents where they actually do community outreach work, and which great information to actually give to the community, because a lot of the conditions and diagnoses that we see in the hospital are repetitive. So repetitive thing over and over and over again, and a lot of it has to do with patient education. I feel like um, being a community nurse, a lot of it has to do with education. So starting off somewhere small and kind of pushing it out towards the community so they can be entitled, empowered, educated, most importantly, that these hospital stays, these hospital visits, and these diagnoses can be can be prevented. So there's definitely a lot of work a lot of work in education that I'd like to get out of this class, because the community is technically who we are. Being a nurse is just, it actually isn't just being a nurse. I mean, you serve the people, you serve the community, and so on and so forth. But once again, I'm super excited that we're in our last class um, of this program. So congratulations to everybody, and feel free to say hi. Bye, guys.